patients and athletes lack toe touch because of tight hamstrings, or could it be something else? Go ahead and sit up. Try touching. So there's his first toe touch, tight hamstrings. Arms across, elbow down, hold tight. Good. Elbow down, hold tight. Okay, flat on your back. So what I'm going to say is that his toe touch is tight because of tight hamstrings due to the law of reciprocal inhibition. So if his abs, which should be pulling him into lumbar flexion, are not facilitated and not pulling him into flexion, nobody is setting the reciprocal response to the hamstrings to say contract less, which means they contract more and try to yank him backwards. So if we facilitate lower abdominals and then have him come back up, arms across, elbow down, hold tight, good, elbow down, hold tight, good, touch toes. Now we get increased toe touch. Is that better on hamstrings?
Yep.
Less hamstring tightness, and we did nothing to his hamstrings.